That looks pretty cool. Hey, what's going on, guys? My name is Dr. Ross. For those of you who don't know me, I graduated from University of Maryland School of Dentistry last year, and I'm just now finishing up a general practice residency at WellSpan York Hospital in Pennsylvania. And I will be starting work as a associate dentist in about a month and a half. So I posted to Reddit 2 weeks ago now. I was posting to a subreddit asking dental students if they had any questions for me, given the fact that I just graduated from school, I'm finishing up a residency, and I just got my first job. And so this video is kind of geared towards those individuals, people who are, one, considering a residency, two, trying to figure out what finding a job in private practice is going to be like, and then any other miscellaneous questions that they might have. So I have the questions over here, and I'm just going to read through them, and yeah, let's get started. So Dennis Clout asked a few questions. What are the collection and production percentages that I have encountered? Production is what you produce when you're working as a dentist, and collections is what the office you're working in actually receives at the end of the day. So if you do a crown for a patient and the patient never pays the practice, then you might have produced $1,000 because the crown is worth $1,000. But if the patient never pays your practice, then you collected nothing. So to answer your question, in terms of percentages that I've encountered, anywhere between 25 to 35%. If you're dealing with collections, I would hope it's anywhere between 30 to 35, and then production anywhere between 25 to 30. Yeah. How do those differentiate between corporate and private practice? I didn't really notice any differences. How much did a GPR assist me in finding a higher paying job, and did private practices reach out more to me? A GPR absolutely helped me find a great job. You know, when I was applying to certain companies and offices, they were very receptive to the fact that I've done a residency, and they were very glad to hear that. In terms of private practices reaching out more to me, offices weren't really reaching out to me. It was the other way around because I was the one applying for jobs. The always asked question, was a GPR worth it, or is doing corporate for a year about the same? So to answer the first part of your question, is a GPR worth it? I suppose I'm biased here, but I will say absolutely 100% yes, a GPR is worth it. You're going to receive an education at a residency program along with practicing clinical dentistry, whereas if you just go to work for a corporation, it's just 100% clinical dentistry. You're there to make money for them. That's your sole purpose. Residency program, programs have built-in continued education. You're doing case-based seminars, you're giving lectures, you're receiving lectures from specialists. I would consider a GPR to be a more well-rounded experience for individuals that are seeking to step their dental game up before they actually enter private practice. Interesting ways to find a better job while being in your last 2 years of dental school. I guess an interesting way is if you know where you're going to work, start reaching out to dentists in that area. Let them know, hey, I'm a third-year dental student. I'm going to be graduating soon, and I'm very interested in working in this area. If that office is not expecting to hire an associate in 2 to 3 years, they probably know someone that will. It's all about networking and creating those connections, and the earlier you can do that, the better. Any courses or procedures that you would emphasize to learn as much as you can from while in dental school? Learn as much as you can from every single procedure that you do in dental school. I know that doesn't really answer your question, but for me in dental school, for the most part, I just wanted to be good at everything. And there's already so much to learn in dentistry. You have removable prost, you have fixed prost, you have operative, you have oral surgery, you have endo, you have oral facial pathology, you have radiology, you have ortho, you have perio, you have implants. it's never ending how much information you can learn. And so the goal is to be well-rounded. But keep in mind, if you're in an area where you have the ability to refer to specialists down the street from you, maybe you don't ever have to do a root canal ever again. You can just refer it to the endodontist down the street, and that works for a lot of people. We have Zizzy Va 17 asks, as a D4 who absolutely hates dental school clinic, tell me honestly, does it get better? So I have to tell you honestly, I can't. I remember being in your shoes. Honestly, dental school wears you so thin. It makes you feel like dentistry is going to suck. It really doesn't. Just like not having to flip my own chairs makes my day. It absolutely makes my day. Being able to do a filling and have someone who sits next to you and suctions the water coming out of your handpiece and hands you things while you work changes your life. Gosh, I mean, I could go on and on and on and on and on about things that I hated while in dental school, and you don't have to worry about so many of those when you graduate. The light at the end of the tunnel is almost there, so just keep on working at it. 000676 asks, your thoughts on practicing straight out as an associate versus a GPR. I've never spoken with anyone that's done a GPR and regretted it. So usually people want to go straight out to work as an associate because they want to make more money. But I'm going to give you a hot take here because I think you actually end up making more money if you go to a GPR. And here's why. Because when you go to a GPR, you learn how to manage medically compromised and just really challenging patients. In addition to that, depending on the program you go to, you might receive clinical hands-on education with implants, with root canals, things that in private practice will make you a lot of money. If I had gone into private practice instead of a GPR, I would absolutely not be placing any implants. I would probably be referring most, if not all, of my root canals out. But by being in a GPR, I have access. I literally text our program's oral surgeon regularly, as well as our endodontist and our periodontist, who will hold our hand while we're doing implants. Like, I'm not kidding. Like, my hand will be here and his hand will be here, and he is guiding me while I'm doing surgeries. For 99% of you, I would recommend a GPR. The only 1% where I feel like you could absolutely get away with going straight out is, one, you're already super confident when you come out of dental school, because if you're not, do a residency. And then two, you should have a parent or a very close mentor who is willing to teach you hands-on certain procedures and be willing to help you out when you get stuck. Because if you don't have that as a new associate straight out of dental school, when you do get stuck trying to do molar endo, you will not be able to finish it. You will have to refer it to an endodontist, and then you'll never do another molar endo again. Anyways, Dance Krista asks, why did you do a GPR and did you get what you wanted out of the program? For me personally, I wanted a transition from dental school to private practice. I felt like a GPR was the perfect opportunity for me. In dental school, I was seeing 2, maybe 3 patients a day if I was lucky. In residency, I'm regularly seeing anywhere between like 8 to 12 patients. So I'm doing a lot more dentistry. And in private practice, I'll probably be seeing that same amount. The only difference is that I will also have to be dealing with hygiene checks. I wanted to take it as like a stepwise approach. I didn't want to jump right into the deep end. KG Statler, knowing what you know now, what would you do differently if you were a student just about to enter their clinical years? If I had to go back in time and redo my clinical years, I would probably spend a little bit more time. And now, of course, this depends on the type of dental school you attend. But if you have access to specialists, try and pick their brains as much as you can, because those folks they didn't only go through dental school, but they also went through additional years of training to get really good at a specific part of dentistry. So they're the best individuals you can talk to about certain things. Not to say there aren't general dentists that are really great at endo, but you're probably better off just talking with an endodontist that's upstairs in the same building as you, and learning from them. And it's just, be curious. Don't waste your time. In dental school, especially my clinical years, if a patient no-showed, don't just sign in, get attendance, and then leave your clinic. Stay and help a colleague of yours go up to the specialty programs, see if there's a resident that you can assist. Just learn as much as you can. Take advantage of all the minds that are present, because you would be surprised how much you're going to miss having those people around once you're actually out of school. Shika Capo, I'm just not saying any of these names correctly. What was the worst part of dentistry or dental school up to this point? The worst part of dentistry is probably dealing with really difficult patients. I've met so many wonderful people through this profession, but I've also met a lot of nasty people. So probably the worst part of dentistry is just, on the occasional day, you'll just lose a little bit of faith in humanity. That's all. And then dental school, the worst part of dental school was I hated having to flip my chair. I absolutely hated it. I really disliked having to take impressions and pour them up. I understand that it's good to know how to do those things, but I certainly disliked it. All right, so Rip Lefty asks, how does a GPR and an AEGD compare? So don't quote me on this. Do not, seriously. But a GPR is hospital-based. You're going to be dealing with medically complex patients. You might be getting more surgical experience at a GPR. You're going to be dealing with oral-facial trauma and infections. You're going to have a more hospital-based experience, just in general. An AEGD is dental school-based. For example, in my dental school, we had an AEGD program. And that was for individuals who just wanted to basically stick around for an extra year. They would see more patients than they were seeing in dental school. They would usually have their own assistant, and they got to do more difficult procedures, maybe more fixed prost, more endo. I mean, for me though, I just wanted to get out of dental school. I just didn't want to be in a school. And so I felt like I'm still getting an education at this hospital that I'm at, but it's not I feel like there's so many things that tie you down when you're in an educational institution. And I didn't want to have to deal with that. But I also know people that are in AEGDs right now and they love their programs. So, it's worth looking into if that's something you're interested in. Also, I believe you make less at an AEGD. You make more as a general practice resident. But I'm trying not to make this about the money. I think it's more about the experience. So Sifar World asks, how did you go about finding your associate dentist job? Well, thanks for asking, bud. You just go online. There's websites like Indeed and Glassdoor. Craigslist, I've heard of people getting jobs through Craigslist. Word of mouth, just if you know the area you're going to work in, reach out to some offices. You'd be surprised. Everyone knows each other. So for me personally, I got my job through Glassdoor because I felt like applying for jobs was really easy. You just type in basic information about yourself and you attach your CV. Ooh! All right. We're making progress here. So, Dutch farmers. They asked, 1, why did you choose to attend UMD? What are your thoughts on the school now that you've graduated? Good school or bad? I chose UMD because it was affordable. I was born and raised in Maryland, and I was able to get in-state tuition. I think you get a great clinical education out of it. 2, How much debt did you take on / what's your plan to pay it off aside from just working? Well, that's exactly how I plan on paying it off, is actually just working and paying off my debt. I accumulated anywhere between $200,000 to $300,000. I don't have the specific numbers. 3, what do you think of current dentists trying to be honest about the state dentistry is in? Example, they don't do dentistry because corporations and saturation income is lower than you would think. Do I think their analysis is correct, or are they just bitter? Would you do dentistry again if given the option to restart your life? I mean, I think dentistry is a great profession. It allows you to work good hours and make good money and do a lot of great things for your patients. But yeah, do I think their analysis is correct, or are they just bitter? I think they're just bitter. Would I do dentistry again if given the option to restart my life? I would say so, yeah, because I've loved biology and chemistry since I was a kid. And I feel like this was a great way for me to apply that knowledge as well as use my hands. And the days go by really fast. One second I'm there, the next second I'm done. And I enjoy what I do. So yeah, I would absolutely do it again. Question number 4. What's the best advice that incoming D1s need to hear? What is something absolutely crucial that most incoming D1s don't know about? Making sure to take care of yourself while you're in dental school, whatever that might mean for you. For me, that meant going to the gym regularly, playing intramural sports, basketball, soccer, football, whatever. Just doing things every single day that could distract me from dentistry and studying and just kind of keep me grounded. That was really important for me to get through school. So I'd recommend that. Chums Sum asks, how do you protect your posture as a dentist? It's something I'm a little worried about because my posture isn't that great right now as an undergrad. So I would say actually weight training, lifting weights and strengthening your back muscles and your core muscles. Second thing, utilize as much as you can indirect vision. Every single person watching this video, assuming you're in dental school, you know what I'm talking about. When you're doing that DO on a maxillary second molar, I know at some point you're taking that mirror out of the mouth and you're bending over backwards and you're looking with direct vision. And do what you have to do to get your work done, but just keep in mind you can't do that forever. So try and get more comfortable using your mirror. Third is magnification. So loops are really helpful for being able to sit upright. I can sit back, I can be in a more neutral, natural position, and I can do what I need to do. But the 4.5 magnification blows everything up, makes it appear bigger, so I can still see really well. So those 3 things. To what extent do grades matter? If you're planning to be a general dentist and work in private practice, they don't. If you're planning on specializing, they do. Ortho, oral surgery, things like that are really competitive to get into. You need to have good grades, and then you also need to test well. Lost in Circle asks, how hard is it to find work at the beginning? It's not hard. You just have to look for a couple of days. How many patients did you have till you finished school? I probably had up to like 100 patients in dental school. 3, did you ever forget part of the information that I had learned in my first years and had to read it again? Absolutely, I did. Peak Healer asks, does doing a GPR help get into a specialty? Do you need to own your own practice to have a nice lifestyle? Do you regret going into dentistry? Doing a GPR, depending on the specialty, 1,000% yes. The first that comes to mind is endo. Endo programs like seeing that you've done a GPR or that you've just had experience as a general dentist for a few years. Do you need to own your own practice to have a nice lifestyle? I guess that depends on your definition of nice lifestyle. I'm going to say no, you don't need to own your own practice. The nice thing about owning your own practice is you're the boss and you call the shots. So for some individuals, that's great. For others, that would probably give them crippling anxiety. So owning a practice, it really depends on the type of person you are and the kind of lifestyle that you want to lead. You'll make more money. You'll be able to create your own hours. but you'll have to manage your own business, and there will be stresses with that. Do I regret going into dentistry? No, I don't. Girasol99 asks, I would love to hear about your experience at the University of Maryland, pros, cons, living in Baltimore, and why I chose that school. Yeah, I mean, my experience at University of Maryland, it was great. I lived in a neighborhood just south of downtown called Federal Hill, and I chose that area, one, because I was familiar with it. My older brother used to live there when he graduated from college. But yeah, so my experience at Maryland was nice. It was a long 4 years, but it also went by really fast. I'm going to be moving out of the Baltimore area. I'm going down to Virginia, and I'm going to miss it. I've grown to love the city a lot. Kickball is a huge passion of mine. It's something that I would do every single Thursday in Canton, which is another neighborhood which is east of downtown. So if you have downtown here, you have Canton over here, you have Fells Point, Harbor East around here, and then down here you have Federal Hill. And so any of those, like Canton, Fed Hill, both of those neighborhoods are nice to live in. Canton is a slightly older audience, whereas Fed Hill is younger. You kind of notice that, in Fed is also where a lot of the bars where people are going out. But pros and cons of the actual dental school itself, I mean, it was very affordable, tons of opportunity to learn. Cons, I didn't get to learn how to place implants, but that's why I did a GPR. I have learned now how to place implants, or at least simple ones. I know other schools might give you the opportunity to do implants, but for me, I was mostly concerned with the cost of the education, and that's something that you'll hear about all the time, is the rising costs of tuition in dentistry, and it's more expensive than our medical colleagues. It's terrible. I mean, it's really awful. So for me, I just wanted to go to a school that kept costs low while also giving me a great education, and I felt like Maryland did that for me. It sounds like there was a lot of interest in my GPR specifically. If you're interested in me making a GPR video, or like a day in the life video of a GPR resident, feel free to comment down below. Anyways, take care. If you're watching this before July 4th, have a happy 4th of July. If you're watching it afterwards, I hope you had a great 4th of July. All right, see you guys.